Hello everyone! Have you heard about Ricket Disease before? In this video, we're gonna talk about Ricket Disease. Let's go!
Definition of rickets. Rickets is the softening and weakening of bones in children, usually due to the extreme and prolonged vitamin D deficiency. Normal bone mineralization requires adequate amount of vitamin D, calcium, and phosphate. The function of vitamin D helps to regulate the amount of calcium and phosphate in the body. Lack of vitamin D in the diet or lack of exposure to sunlight make it difficult to maintain proper calcium and phosphorus level in the bones, which can lead to rickets. In rare cases, it caused by an underlying genetic disorder. In adults, this condition is called osteomalacia.
For incidence and prevalence, Ricket disease is very high in many parts of the world, such as Africa, because they have dark skin. It is because dark skin doesn't react as strongly to sunlight as lighter skin does, so it produces less vitamin D. Next, Ricket disease are rare in Malaysia, where sunlight resources are adequate and sufficient, which is the main source of vitamin D is abundance. Then, Ricket was found to be more prevalent in males with 70% than in female, which is 30%. In 2008, high prevalence of vitamin D deficiency, which is 35.3% in Malaysia between age 7 to 12 years old. In 2013, 47.5% of age 8 to 12 years old had vitamin D insufficiency. The peak incidence of rickets occurs among infants and young children from 6 to 23 months and adolescents from 12 to 15 years old.
Next, the etiology of ricket disease. First, vitamin D or calcium deficiency. Due to the UV light exposure, skin produces vitamin D when it exposed to sunlight. Children who spend fewer time outdoor or the users of sunscreen can block the rays that trigger the skin production of vitamin D. Second is food. Fish oil, egg yolks, fortified breakfast cereals, and fatty fish such as salmon and mackerel contain vitamin D. Calcium is commonly found in dairy products such as milk, cheese and yogurt, and green vegetables such as broccoli and cabbage. Lack of food intake contain vitamin D and calcium lead to rickets. Third is dietary supplements. The second causes is due to genetic defects such as hereditary hypophosphatemic rickets. This disorder related to low level of phosphate in the blood. Rare condition in which the kidneys are unable to process phosphate properly. Phosphate is a mineral that is essential for a normal formation of bone and teeth. The third causes is malabsorption, for example, celiac disease and Crohn's disease, and also cystic fibrosis. For the fourth causes, liver or kidney disease. For the liver disease, liver inability to turn inactive vitamin D into active vitamin D, and the kidney problems may be due to the renal tubular acidosis and Fanconi syndromes.
Next, clinical features of condition. The first one is high tendency to get bone fracture. Next, muscle cramp, and pain or tenderness in the bones of the arm, legs, pelvis, or spine. The fourth one is tooth deformities such as delayed tooth formation, holes in the enamel, abscesses, defects in the tooth structure, and increased number of cavities. The fifth one is impaired growth and short stature. Next is skeletal deformities such as an oddly shaped skull, frontal bossing, bowlegs or legs that bow out, bumps in the ribcage, pigeon chest, swelling in the wrist and ankle joint, a curved spine, and pelvic deformities.
Pathophysiology. Decreased availability of phosphorus and calcium to mineralize the skeletal matrix lead to the growth plate disorganization and accumulation of under-mineralized osteoid. This results in growth plate expansion, bone weakening, and skeletal deformities.
Two management of ricket disease, which are conservative and surgical.
Conservative management. Increase the intake of vitamin D and calcium. Consume more foods that are rich in calcium and vitamin D. Taking daily calcium and vitamin D supplements. Increase the child exposure to sunlight. Increase the amount of time of your child spent outside for the safe exposure of sunlight. Genetic or hereditary rickets. For the hypophosphatemic rickets, a combination of phosphate supplements and a special form of vitamin D is required. For the other type of genetic rickets, need a very large amount of a special type of vitamin D treatment.
For surgical, it indicates for severe extremities deformities due to the impaired bone growth and fracture due to the bone fragility. The surgical management includes corrective osteotomy, fixation with external fixators, intramedullary nails, Kushner's wires, plates, and casting. All of this corrective surgery is the only option if legs has become severely compromised, necessary to correct severely bowed legs or other bone deformities. Other problems such as chest or pelvic deformities and growth retardation may be permanent.
Next, prognosis. For the nutritional rickets, prognosis is typically good. With treatment, your condition should be resolved in a matter of weeks or months. Most children treated for nutritional rickets recover completely and grow into healthy adults. For the inherited rickets, prognosis depends on the specific genetic disorder. In many cases, children with this type of rickets can grow into healthy adults. Most bone deformities caused by rickets can improve on their own during growth. However, orthopedic correction may be necessary. In very severe cases, surgery may be recommended.
For impairments and functional limitations, the first impairment is bone pain and weak muscles, lead to delay walking or a change in the way they walk. The second impairment is delayed formation of teeth and weakening of the enamel, can cause difficulty to chew food during eating. The third impairment is numbness or tingling in the fingers or toes, can lead to difficulty to perform self-care tasks.